Welcome to a special edition of Modern Medicine with Doc Moylan. Today we're actually having our annual Cancer Survivors Picnic Celebration of Life here at the Simon Kramer Cancer Institute. And it's a great pleasure to be able to introduce several of our very special patients that we've come to treat over the years. And I'd like to introduce you to Clinton, who is a survivor of head and neck cancer. And I was wondering, Clinton, if you could, before you tell us your story, I want you to put that hat on. Clinton, I'm a movie buff. And as soon as I saw you today with that hat on, which is very practical for shielding the skin from the sun, I said, this is Billy Jack.
Yeah.
And that was such a wonderful movie starring Tom McLaughlin, and it was on an Indian reservation. And it was just a cult production. Tell us your story. It goes back about, what, 9 years?
9 years ago. Yeah, 9 years ago this August. I noticed swelling in my neck, and you never think cancer. You think, well, swollen gland. So I waited 2 weeks. And I went to my doctor, who sent me to a ear, nose, and throat specialist, and took a biopsy and said it was cancer, and asked why I had waited so long. And I tried to tell him no symptoms, it's just a swelling, and that's only been there for a couple of weeks. That's how fast. It was a complete surprise. And he asked me why I waited so long. I was devastated. And then
I'm going to have an aside here. Oftentimes, because us doctors, we're not thinking cancer either.
Right.
Oh, this is an infection. Let's try some antibiotics for a couple weeks. And it really can introduce, it could be iatrogenic or physician-induced delay also while you're waiting for the antibiotic to work.
Well, that's where I was fortunate, because as soon as I went to my family doctor, he didn't prescribe antibiotics. Right away, he sent me to have a biopsy done.
Well, that colleague is well trained.
Yes, Dr. Carl Forster.
Yeah.
In Pottsville. He's retired now.
Yes.
And I think he by his quick thinking, and I think that's probably what helped save me, because after you had examined me and everything, we had determined that it was stage 4. I was devastated. Being stage 4, I wasn't sure if I would make it, and everyone was telling me, go, you don't want to go in this area. And after meeting with you, you just impressed me with your confidence and made me feel at ease, and that you cared. And that goes a big way, I think, even toward the physical part of a disease. If you have confidence in your doctor, and your doctor is upbeat and keeps you thinking positive, that goes a big way toward your rehabilitation when you have a disease. It's all in your approach. And if your doctors are there to instill this in you, that's part of the battle. And that's what I felt when I came here. I didn't need to go out of town. I was so confident, and you told me it's going to be hard, we're going to go at it aggressively, and it was.
Well, let's go into some of the details. You also had some chemotherapy.
Oh yes, definitely. I had, you set me up with Dr. Singla for my chemo, and he was another wonderful doctor. Oh, wonderful doctor, just, he cared. You could tell he cared. And between the radiation therapy and then the chemotherapy, and you two working in sync, keeping notes, keeping everyone in the loop, we just had such a success with my cancer. I was just so elated. Well, you know, I'm not a huggy feely guy, but when you told me I was cancer free, I couldn't help it. I had to hug him and do a little dance, and I don't dance well. But no, these people who seem to think we need to leave this area, I tell them, you don't.
Well,
you don't.
Right now we're in the Peace Garden between the buildings over at Simon Kramer. And behind me to my right is a bust of Dr. Simon Kramer. That's who I named the practice after. And he was one of the key physicians in the 20th century in the cancer field. And he started many initiatives like the Patterns of Care study and the radiation therapy oncology group. And it was just a thrill to be under his tutelage. And to tell you the truth, when I come to work and I see that there's a stage 4 head and neck case on there, it just makes my day, because I know they're not going to be easy, but we have the tools that if we get lucky, we can have a nice result like in your case.
You know, what amazes me is how much medicine has progressed in the last maybe 30 years. Used to be, if they told you cancer, it was a death sentence, you thought.
Yeah.
And I'm old enough to where I was afraid of that myself.
Yeah.
I was ready to accept that, and you weren't. And
now it's such an exciting time in cancer medicine. They have immunotherapy, which is making a difference, antibodies, enzyme inhibitors. It's a whole new ball game.
I have very little knack for science or medicine, but you learn to look into these things once you've gotten into a situation like I'm in. And you start to learn things. Now, even from 9 years ago when I started treatment, when you start looking at some of these new treatments that they have, that even back then they didn't have them.
Well, Clinton, I want to thank you again for taking time from the picnic to join us.
Oh, it's a privilege. It's a privilege. Thank you, doctor. Thank you. Thank you. Saved my life.
Welcome to this special edition of Modern Medicine with Doc Moylan. Today is a special occasion here at the Simon Kramer Institute. It's our annual Cancer Survivors Picnic and Celebration of Life Day. And it's a pleasure to introduce to you Mr. Tom Hoffman, Sr.
Yes.
And you are one of our guests who is not a cancer survivor. You never had cancer.
Never.
But your son did. Can you tell us the story of Tom Hoffman Jr.?
Well, Tom was it's hard to believe he get cancer because he never smoked, and all his activities were so healthful. He did everything. He hiked almost every camp in the state, and his companion, they hiked, and they used to amaze me even when there was a blizzard. Where are you going? They'd go up to World's End Park and hike with snowshoes. So, and figure skating and cross-country skiing, everything healthy. Then when he came down, it's hard to believe when he first had pain, and he went to his regular physician, and they said, Tom, there was some fluid, so he had it done. And naturally, my daughter, after he's in so much pain, she wanted to go down to Johns Hopkins, and they diagnosed him with lung cancer. So recommended you, which I'm so glad, because we lost him, but you tried everything you could, and you were so wonderful for him.
Well, I saw a picture of him recently before he got ill.
Yes.
And he was a strapping fella.
Well, he was.
And I think the picture was at a rock concert.
Yeah. Well, he went to all of him and his. I must have a case full of T-shirts in the 60s and 70s, I guess. They went to every concert there was, and they loved music and so active with each other. His companion, she was sort of a mama's girl, and he was a father. I always thought I was going to have her as a daughter-in-law, yeah. But they did everything together, and they were a wonderful companion and did everything healthy. That's what makes it so hard to believe, but who are we to wonder why?
Yeah, for sure. Well, you mentioned Johns Hopkins University.
Yes.
And he was evaluated by a famous, rather world famous chemotherapy doctor, medical oncologist by the name of Dr. David Ettinger. As it turned out, here at Simon Kramer Cancer Institute, we have an annual cancer symposium, and we invite doctors from all over the, I would say, the East Coast, but we've had people from Los Angeles here. And one of our guest speakers was Dr. Dave Ettinger, and he came here. I gave him a tour of it, and he was pretty impressed. But I think that's how he made the connection. And of course, they have access to experimental drugs that they don't even have names yet. They're just numbers and letters. And again, I have to attribute your son's relative success to his fighting spirit, as well as access to these cutting-edge drugs from Johns Hopkins.
I was just baffled because he was ready to go. He was going to go down on Tuesday. He would have been down there for 3 days for a trial to see if that worked, the medication. And it happened Sunday. He took a turn for the worse. And unfortunately, I miss him, but there's no more suffering.
Yes.
And you certainly relieved him every way you could.
Well, the other thing that I'll mention here, we're in the Peace Garden, but in this garden there's a tree that's been planted in Tom's honor.
Well, I want to
thank you for all your support, and we'll keep Tom in our prayers.
Well, you keep in touch with me, because you're very special to
Thank
me.
you. Thanks.
I'm alone now, except my daughter down Maryland, and Darlene, who is being treated now, and I know you're going to treat her well.
Great.
Thank you very much.
You're welcome. Welcome. Now get back there and enjoy the rest of the picnic.
Oh, I will. It's a wonderful thing you do here.
Ms. Canfield, I want to thank you for taking time from the picnic to join us here in the Peace Garden to talk about your experience, personal experience with cancer.
Thank you, Doctor.
You've been coming here many, many years to enjoy the picnic. But how long has it been since?
Almost 7 years now, Doctor.
7 years. Yeah.
Yes, yes.
And how was your problem detected?
I have been going for years and years for a mammogram and a pap test. And thank God with the mammogram, it wasn't on the side of my breast, it was under my nipple. And that's where they found it.
That's a particularly difficult area to read on a mammogram. It can be because of natural glandular tissue. But I think the take-home message for our viewers is please keep getting these screening tests.
Oh, yes.
They're very inexpensive in the overall scheme of things. And there is some national organizations that are trying to discourage it. Same way with PSAs for men. Please keep getting tested.
Well, if I wasn't getting a mammogram, I would have never known. And thank God, because like I said, it wasn't one of these that was on the side of the breast that I could have felt the lump myself.
Yeah, yes. Back in the old days, the standard treatment for breast cancer was removal of the breast.
Right.
And I'm sure that was mentioned to you, but they gave you other options.
Right, yes. Dr. Wahab was my surgeon, and he said it was my decision, and I decided against it.
I have to say about Dr. Wahab, and he has retired and we miss him dearly, but he was an older surgeon in the community, and what they say about teaching an old dog new tricks, he got right on the bandwagon for this new technology and offered to his patients. And you know, he's an artist.
Yes.
So his surgery was part of his art form.
Yes.
Yeah.
Yes, he's doing very good. He's painting. I saw him last week.
Did you?
Yes, and he misses it.
Yeah.
But I still say thanks for him, and especially thank you to you for me coming to you, because with the problems I had and everything like that, you're not just a doctor. You're my family, and you're my friend.
Well, you were telling that story about me being on the refrigerator with the other grandchildren. You know, so.
On my refrigerator at home, I have all my grandchildren. And a couple years ago, my little grandson, Gino, he said to me, "Nanny, why is this man on your refrigerator?" Because it's only the kids, it's not, you know. And this guy's all dressed up, very handsome looking. And I said, well, you know, Nanny has cancer, and this is my doctor, and he's given me good medicine, and he's making me better. So every time he comes, he still asks me, 2 years later, and he comes to the picnic, he meets Dr. Moylan, and he always says, "Nanny, why is that man on your refrigerator?" So I said, well, Nanny has to get a new picture with Dr. Moylan, and then Nanny and Dr. Moylan can be on together.
Well, and then the way you're able to talk to your grandchildren about a diagnosis of cancer.
Right.
It's no longer taboo as it was one time. You know, it was the big C, and
Right.
that fortunately that has.
Yes, because by having a picture on my refrigerator, now they know you're my doctor. They know you're making me better, and they look up to you too.
Thank you. Now, refresh my memory, did they put you on hormone pills?
I took Arimidex.
Arimidex?
Yes.
How many years did you have to take that?
2, and that's when I had the problem with it. Yeah.
Yeah. Now, there is a lot of research going on in the field of breast cancer. It's amazing what's happening there, but they're looking about how many years is optimal for these hormone
Right.
pills. 5 years was a standard. Now they might even be extending it in some of the latest research.
Well, then I was on 3 years after that on tamoxifen.
Yeah.
But then because of the last 2 years with no signs of breast cancer in my pap or my mammogram,
Yeah.
the doctor that I'm with in Reading now took me off of it.
Yeah, terrific.
But I still come to Dr. Moylan every 6 months. I still come for my checkup. I still believe him, and I'll never stop.
Well, when I tell my patients, when they say thank you, I say, no, the privilege is mine, because I know you have many choices to go. As we heard from the previous patient, you could go to Philadelphia, New York, but it's a privilege to be able to take care of you.
Well, nobody wants to go anywhere else because everybody wants to come to Dr. Moylan. And I certainly thank you, and so does my family.
Thank you.
Thank you.
Welcome back to Modern Medicine with Dr. Moylan. It's a pleasure to introduce to you Tammy, who's a cancer survivor, and she's participating in today's Cancer Survivor Picnic at the Simon Kramer Cancer Institute and our special celebration of life.
That we are.
Tammy, could you tell us a little bit about your problem with cancer? When did it start? And
Yeah, well, it started way back. I was moved to Florida. I found it when I was in Florida. When I was diagnosed with the cancer, I didn't want to switch all around. I was gonna take care of it when I was in Florida. But when I got down there, I was going from one side of the state to the other because of the relationship I was in. So I was going through hard. Plus I was going for my bachelor's degree in criminal justice. So I'm working with that. And my doctor's like, down there, says, you need to take care of this. He says, because it could kill you. And I'm like, well, I can't. When you get into with cancer, my thought is, once you start cancer and you go through like chemo, you want the same doctors. You won't want to keep switching. Like I said, I was down in Florida and he's like, you need to take care of this, but I knew I was coming home. I knew I wasn't gonna stay down there. I stayed down there only because of college. But when they said I could do it online and bring it back with me, then I did that and I came home. So when I came back here and I was stable, then I got a doctor, my primary physician is Dr. Allshafer, which I didn't know who to go with. When you come to a new area, your other doctors are like, all my doctors were in Saylorsburg. So I got Dr. Allshafer, went with her. It was Gregory Dubois, under Gregory Dubois.
yes.
And then I got Dr. Andrea Allshafer. And she's like, oh, you need to get a mammogram. And she sent step by step, what we had to do. I just kept a bright spirit on everything. And
Well, the spirit, very important.
Yes.
And of course, your young age and general
Yeah.
vitality was certainly a factor.
And now after I went to Dr. Gandhi, they were trying to put me on a clinical trial and asked me if I would take an extra drug for my chemo.
Yep.
Well, once they did the biopsy, they took my right side. I'm about 45 years old
Yep.
when this started. They took my right breast. Well, they did the biopsy. Then I came back. August 5th, he tells me of 2015, you have cancer. So most reactions would be like, oh my God, and start crying. I'm like, okay, now what? I got an upcoming mammogram, but they keep close eye on me, all three of my doctors. Dr. Moylan for my radiation, excellent. I mean, everything just lined up for his radiation. Wonderful job, wonderful job.
Well, it was
No
It
reactions.
was a privilege to take care of you. I think the message I would send out to our viewers is pick a group of physicians that you're comfortable with,
Yep.
and then stick with them. And the follow-up is very important.
Yes.
Coming in for the regular checkups, monitoring the mammograms, and that's kind of a key to health.
Yes, it is. And I don't like doctors, but since I was diagnosed with this, I mean, cancer could have took me. Cancer didn't take me, I didn't let it.
Yeah.
I fought, I kept a positive attitude, keep a positive attitude, and you can get through anything, anything.
Well said. Well said, Tammy. Again, thank you so much for joining us today.
Thank you.
God bless you.
God bless you. Thank you so much.
You're welcome.